I just heard Dr. Bruchalski speak, and I really, coming from a patient side, being a patient at Tepeyac Family Center, and also being a pro-life woman, I just really want to vouch for what he says about women desiring pro-life practices. I can't imagine choosing a different practice, and I often get frustrated when I hear these political debates about conscience rights for doctors, because I feel as a patient I have a right to a pro-life doctor, and doctors therefore absolutely have a right to practice their own faith and their own beliefs in their medical practice.
My name is Blaise Milburn, married to Sarah, and Dr. B delivered our child, Coleman. He's 17 months old also, so
yes,
it's great to hear him speak this evening. Coming from a medical student's perspective, you know, there definitely is kind of an underlying, I don't know how to say this, but you don't feel like you're entirely welcomed as a pro-life student. You feel like you might be in the minority. But I think increasingly there's more and more of us that are being identified, and then you have people like Dr. Bruchalski, who's able to support you as a pro-life medical student. I just think it's really important to find those mentors and to listen to them, take their advice, and use them as a base of support. And more students, if they do that, they're going to be able to come together and see that there's really a lot more of us out there than it seems, than the environment seems like there is. So I would just encourage all students watching this to join pro-life groups where possible, for some solidarity, for some support of each other. Because there's and what I've heard in the medical field, especially OB/GYN, there's some resistance, and it's important for us to be there for each other and to find mentors like Dr. Bruchalski out there. So, yeah, that's all I have.